Corporate healthcare turned me into a number machine. Had to quit after they wanted me to kill a patient. I was a nurse for 15 years. I loved my job and my patients. I worked in a small hospital that was bought by a large corporation. They immediately started cutting costs. They laid off staff, reduced our hours, and increased our workload. They also started charging patients for things that were previously free, like parking, TV, and Wi-Fi. They even started charging for things that were medically necessary, like oxygen and IV fluids. We were told to push unnecessary tests and procedures on patients to increase revenue. We were also told to discharge patients as soon as possible, even if they weren't ready. I remember one patient who had a stroke. He was in the hospital for 2 days before he was discharged. He was still unable to walk or talk. His family was told that he would need to go to a rehabilitation facility, but they couldn't afford it. He ended up going home and his family had to take care of him. He never recovered. I finally quit after I was told to discharge a patient who was in the ICU. He was on a ventilator and was not stable. I refused to do it, and I was written up. I knew that if I stayed, I would eventually be forced to do something that would harm a patient. I now work in a clinic that is not owned by a corporation. I make less money, but I am much happier.